So why do they crumble under pressure?
Samir, we can start.
Yes, sir.
We didn't go at
Once
live.
the music finished, yeah. Respected friends, teachers, and my colleagues and junior friends and senior colleagues, Namaskar Saryanna. Today we have on the YouTube live, also on the Zoom, regarding the Maha AP program number 569 live video so far. And we are almost on 5,400 subscribers for the Maha AP Subspeciality and all other programs on the Maha AP YouTube channel. Every time senior faculties in the particular expert in the particular subjects, they comes to us once in a month and speak about their subspecialty, and we all get wiser with this along with a few questions and answer sessions in this session. This time the subspecialty is newborn nutrition, and we have very good eminent speakers across India for this program. So we are arranging this program from last 2 years under the able leadership of the Maharashtra IP president. Previously with Dr. Gangulia sir, and now with Ramakant Patil sir, along with my colleague Dr. Sachin Patil, who is also the co-host for this program, and under the able leadership of the other people, including the Shyam Chaudhary sir, Milind Bhardia sir, and Prashant Jadhav sir. So we are continuing with this program, and today is the 10th program for this year, and we are continuing this program for another 2 months continued now. So I will hand over to my colleague Dr. Sachin Patil to undergo further needful for these things. So Sachin, are you there?
Yes, sir. Thank you,
Yeah,
Samir,
okay.
sir.
So please take up this one.
Thank you, Samir, sir. Good evening, all. Myself, Dr. Sachin Patil, EB Maha AP 2023. I am highly honored to take this opportunity on behalf of Maha AP to welcome all for today's session. Now, I request Dr. Ramakant Patil, sir, the President of Maha AP 2023, to guide us and bless us with sir's visionary ideas for today's session. Ramakant, sir, over to you.
Thank you, Sachin. Good evening, all respected teachers, fellow academicians. We have got an honor today as guest of honor, Dr. Basavaraj sir, CIIP President-elect 2024, who has obliged us for joining this program of Subspeciality Connect, and he has found time for us. So I welcome Basavaraj sir and today's speakers. In keeping with subspeciality, we have got, as Samir has said, neonatal feeding nutrition, and it is a wonderful topics chosen by Samir Sadavarte and Sachin for this subspecialty connect session, which is 10th session. And sole credit goes to Sachin Patil from Yavatma, who is EB Maha AP, and Samir Sadavarte for perpetually having a successful episode after episodes, and we have not missed a single episode, and this is already a 10th episode. So thanks to them, and they are doing under able leadership of Dr. Shyam Chaudhary, who happens to be Vice President of Maha AP for 2023, and Dr. Prashant Jadhav, who is in charge for Subspeciality Connect. We have got our colleague, a friend and head of department from D.Y. Patil Medical College, Dr. Shailaja Mane Madam. Many first are to her credit. She is the founder, state president of IYCF in Maharashtra state chapter, and she is a founder of Human Milk Banking Yashoda. A formal introduction will be done by Sachin, but still I could not resist that so many things are to her their credit, and her topic is also applied physiology of lactation, and was many times it is not the glamorous topic, but this is the most essential thing we could do for the nation building and transgenerational approach. It will definitely have a wonderful impact on transgenerational. And first 1,000 days feeding is more important, and that makes lifelong changes, and not only particular person's changes, but it becomes a transgenerational changes. And we have got another speaker who is friend of mine, even if he's junior, but he is a tall stature in his achievements, academics, and more important than academics, he has got more holistic view about life. Here, many things he is doing which I envy that I could accomplish and do in day-to-day life. So he's going to talk on gut-brain axis or neonatal nutrition and future implication or neurological outcome. So these two eminent speakers are there, and I welcome Dr. Sachin Gaikwad, who is MMC observer for today's program. And I really acknowledge the persistent support given by Dr. Pallavi Dharmadikari for episodes after episodes for nearly 6 to 7 programs are there every month. And she's there continuously for whole programs. So I will like to express our gratitude to her that relentlessly, untiringly she is doing this. So with this, we are all here to listen to Dr. Sudhir Malode and Shailaja Mane ma'am. Over to you, Sachin.
Thank you, Ramakant sir, for your inspiratory speech. You are always an inspiration for our young pediatricians. Now, please give a warm welcome to our today's guest of honor, whose achievements are second to none. It's my pleasure to introduce our guest of honor, a person of remarkable distinction and accomplishment. It is with great honor I am introducing Dr. G. Baswaraja sir, who left an indelible mark on our pediatric community. Very good evening, Baswaraja sir.
Good evening, Sachin.
Sir is a professor of pediatrics in Indira Gandhi Institute of Child Health, Bangalore. Sir is a national president-elect 2023 of Central IP. Sir was a national general secretary for 2020 to 21. Sir was a national chairperson for IAP Intensive Care Chapter 2021. Sir was a founder secretary of IAP ID Chapter Karnataka. Sir got recipient of Dr. Y.C. Mathur Oration, recipient of Dr. O. Ganesh Memorial Oration. Similar multiple orations are there, and sir is on the editorial board of General Pediatric Infectious Disease, General Pediatric Critical Care. Words are not enough only to introduce sir. So now I request Baswaraja sir for and bless with their wisdom for today's program.
Thank you so much, Dr. Sachin K. Patil, for your kind words. Our Honorable President of Maha AP, Ramakant Patil ji, and all the other dignitaries who are there virtually on the dais. Maha AP is always known for an excellent academics in the year 2020, where they started in a DAP platform by their own and carrying out in many programs, which is a very, very qualitative across the almost for the last 3 to 4 years. And today's program, which is a very, very relevant to the day-to-day clinical practice, especially nutrition of a newborn is a most important thing. When we talk about the nutrition, gut and brain, these are the things which are interconnected each other. So fortunate to have a Dr. Malwade, who is going to deliver that. This is very, very relevant to the clinical practice. And Dr. Shailaja Mane, who has been known, when you want to achieve a successful breastfeeding, what is most important is to have a physiology of a lactation. That's the most important thing. These are the more relevant for the practicing pediatrician. The topics, both the topics which has been chosen by the Maha AP, which is very, very relevant to the day-to-day clinical practice, not only for clinical practice, even for the nation building too, in terms of reducing neonatal mortality as well as the underpowered mortality. Even just simple measures like a breastfeeding can achieve a bigger thing in a neonatal as well as infant mortality. In this regard, I am sure whatever the topics which has been chosen by the Maha AP President Dr. Ramakant Patil, along with the Sachin Patil, who is going to moderate, and Samir Sadavate. The moment we talk about Samir Sadavate, he is not only the legal expert, intensivist, and also is a great organizer, carry out any program which is given to him. He is also happens to be my close friend too. So with these few words, I'll not take much time. Wish you all the best for the program. So I'm looking forward to more academic activities by the Maha AP for more innovation, more creativity.
Thank you, sir. Definitely, we all Maha IP will follow your advice, and in the further time also in 2024, we will have a lot many academic activities. And whenever we need your guidance, definitely you will be there. That's now I request Mohan Warke sir,
Good evening.
please introduce our
seniors and-
speakers.
Good evening, seniors and colleagues. Myself, Dr. Mohan Warke, Treasurer of Maharashtra IP. I welcome our first speaker, Dr. Sudhir Malwade, who is DNB Pediatrics. He has done fellowship in neonatal perinatal medicine and newborn emergency transport system, both from Australia. He is currently working as head of department in NSU and professor of pediatrics in Dr. D.Y. Patil Medical College and Research Center, Pune. He is also consultant neonatologist at Unique Hospital, Pune. He is instructor of advanced and basic neonatal resuscitation program. He is also lecturer for Government of India sponsored RCS program. He has more than 40 publications regarding neonatal topics like neonatal hypoglycemia. He has special interest in neonatal cardiology and neonatal neurology. Our second speaker is Dr. Shailaja Mane. She is professor and HOD of pediatrics, D.Y. Patil Medical College and Research Center, Pimpri. She is founder president of Maharashtra State Branch of IYCF chapter of IAP. She is also founder and director of Yashoda Human Milk Bank. She is also EB member of Women's Doctor Wing of IAP NCDPA IMA Pimpri Chinchwad branch. She is also selected as faculty in adolescent health research of Network of India for WHO. She is also in charge at Association of Child and Adolescent Health of India, Pune branch. Over to you, Sachin.
So we welcome Professor Dr. Shailaja Mane ma'am and Dr. Sudhir Malwade, sir.
Thank you,
Over
sir.
to you for further proceedings.
Please share the screen.
Sudhir, over to you. You can start and share
Sudhir,
the
sir.
screen. Yeah,
Yes, sir.
yes,
Start the session.
yes.
Thank you. Can I begin?
Yes.
Yes, sir.
Yes,
Yes, sir.
yeah, you are
Yes, I'll.
audible and clear.
Yes. I would like to begin my talk by thanking Maharashtra IIP. Thanks again for giving this opportunity to me. So this would be the structure of my talk. I'll be talking about microbiota. What is it? The establishment and composition of gut microbiota, the factors affecting it, the functions of gut microbiota, dysbiosis and things dysbiosis can cause to the developing brain, gut-brain axis, then implications of gut-brain axis in health and disease, and how we can restore that gut-brain axis. So all diseases begin in the gut. This is what the father of medicine, Hippocrates, said 2000 years back. And now we all know this, thanks to the research in this field. But now I'm going to talk about the new emerging concept of gut-brain axis and its role in health and diseases. So the gut microbiome comprises a vast ecology of commensal bacteria, archaea, fungi, and viruses in and on the body. And in a bidirectional communication, the gut microbiota play a crucial role in the gut-brain axis when it regulates the key physiological and homeostatic functions, including the brain development, immune regulation, and behavior. So the understanding of this gut-brain axis will offer some insights into the therapeutic and dietary approaches that may improve the outcomes of CNS, neuropsychiatric related disorders, especially the long-term complications of preterms and very low birth weight babies. So can you imagine how many microbiomes are there in our gut? So and what is it? So microbiota is a collection of microbial community living in the gut. And there are more than 1,000 different types of microorganisms. So trillions of 10 raised to 13 or 10 raised to 14 microorganisms harbor our intestinal tracts, and they'll have a symbiotic relationship. And if something goes wrong with this relationship, then the disease begins. Now, the total combined weight of this microbiota, which is harboring our gut, is more than 1.5 kg, and it occupies the surface area of more than a table tennis ground. The total number of cells are 10 times more than the cells of the human body. And like genome, there is something called as microbiome, which is a collective set of genes from the given microbiome. And the collective microbiome is 150 times human genomes. So we can imagine and we can think that whether we are human beings, we are superorganisms. All our bodily functions are controlled by these organisms. And this microbiome plays a role not only in developing brain, but also regulating the immune system, endocrine system, and it also modulates the digestion. Now, how does this infant microbiota composition starts? So at birth, at 0 month, you can see the gut microbiota is dominated by enterobacteria. So the facultative anaerobes such as E. coli, streptococci, they are the ones who colonize the gut first. They consume the oxygen in the gut to create an anaerobic environment. And then the bacteroids and bifidobacterium and clostridium colony, they colonize the infant gut or neonatal gut by postnatal day 4 to 7. And then bifidobacterium predominates the gut in the human milk-fed infant. So there's a different microbiota for the milk-fed infants and formula-fed infants. And if you look at the figure carefully, for 1 to 2 months, for first 1 to 2 months, it is bifidobacterium which is dominating the gut microbiome, followed by lactobacillus, and by almost 3 years, the gut microbiome of infant is like adult microbiome. So what are the factors that affect the gut microbiome composition? So there are several factors: the genetics of that individual, the maternal factors like maternal weight, maternal comorbidities, maternal diet, then gestational age, which is an important factor, then the mode of delivery, modes of infants feeding, whether it's a formula feeding or breastfeeding, then the complementary feed, which causes a major shift in the gut microbiome after 6 months of life, and the antibiotics. And some of the minor factors like the latitude, the seasons, the number of siblings in the house, the fermented food, pets, and circadian rhythm also plays an important role for that establishment of a gut microbiome. And this gut microbiome is always in a dynamic process, dynamic relationship with the diet, environment, and the nutrition. So what are the biggest disruptors of this colonization? Now, the maternal neonatal microbiota is in constant exchange throughout the pregnancy. So during the pregnancy or at the time of delivery, the disruption, because of many reasons, may prevent the natural development of neonatal microbiome, the development and the maturation of neonatal microbiome. And that increases the neonate, or that puts the neonate for the long-term risk of metabolic and immune diseases. And now I'm going to talk about the 4 most important villains which can disrupt this microbiome development and maturation. And one of them is premature delivery, cesarean section, formula feeding, and antibiotic use. So let's start with impact of gestational age. Now here you can see on the right side, there's a figure documenting the colonization of bifidobacterium and days of life. In term infants, you can see that the colonization starts from day 1 itself. And you can see the number of logs. So the diversity and richness of microbiome. And in preterm infants, the colonization starts after 5 to 6 days. So if you look at the microbial community of premature infants born at 25 to 30 weeks, it is dominated by Staphylococcus, followed by Enterococcus. And by 30 to 35 weeks, the Enterobacteria dominate after 35 weeks of preterm. Now, preterm infants have a delayed progression, as you can see from that, the delayed progression to achievement of bifidobacterium dominated community, and they have a low diversity. While a term infant's microbiota is dominated by bifidobacterium. Now, this bifidobacterium is essential for prevention of adhesion of pathogenic organism to the intestinal wall, as well as it also plays an important role in secretion of bactericin, then maturation of enteric nervous system, also plays an important role in innate immunity. So there is a lot of dysbiosis going on in preterm infants related to the gestation age. Now, coming to the second factor, how vaginal delivery and cesarean section can impact the development and establishment and maturation of that gut microbiome. So, in vaginal delivery, the source of the initial gut microbial flora for that neonate is maternal vaginal and perineal flora as well as the skin flora. For the cesarean section baby, it is predominantly the mother's skin and nosocomial environment. And if you look at the microbial diversity, there's a greater colonization and higher diversity of gut in vaginal delivery babies, while in cesarean section babies, there's a delayed colonization, lower diversity of gut microbial flora. And if you look at the composition of gut microbia, it resembles predominantly the mother's vaginal microbial flora, which includes lactobacillus, Schnitzia, bifidobacterium, and prevotella, while in cesarean section babies, the flora consists of the skin organisms like Staphylococcus, Corynebacterium, and Propionibacterium. So seeding at birth, that means the beginning of that and maturation of that microbiome is normal in vaginal delivery and abnormal in cesarean delivery. So मराठीमध्ये एक म्हण आहे संत तुकारामांची की शुद्ध बीजा पोटे फळे रसाळ गोमटी. The seeding which is there at vaginal delivery, the normal formation of microbia, which is going to affect your health for the rest of the life, and which can, if something goes wrong or dysbiosis, then it can affect not only the temporary or upset of GI, but can have a long-term effect in terms of multiple sclerosis, Alzheimer's disease, and Parkinson's disease. So that seeding is very important, which occurs in vaginal delivery. And unfortunately, the cesarean delivery babies, they have abnormal seeding. So they not only develop abnormal flora, but their interaction with the immune system is abnormal. And that's why they have a high chances of atopic dermatitis, eczema, allergic conditions, obesity, and ADHD, as well as a autism spectrum disorders incidence is also high. So the development of immunity, you know that 80% of the human's immunity in the gut. So the development of immunity is normal in vaginal delivery and which is abnormal in cesarean section delivery. Now, moving on to the next factor, how breastfeeding versus formula feeding can affect the development of that microbial flora. So on your left side, you can see beautiful garden. So that is what exactly happens when you feed the baby with breastfeed. So they have a good bacteria, enriched bacteria of bifidobacterium, lactobacillus, and staphylococcus. While if you feed the baby with formula feed, you can see the abnormal growth and weeds in unkept garden, which is on your right side. And these have increased levels of Escherichia coli, Clostridium difficile, bacteroides, and fragilis. So formula feed infants, they have abnormal colonization, abnormal maturation of gut microbiome, which can again lead to increased incidence of those atopic diseases, asthma, obesity, and behavioral problems. So this was our third factor. Now coming to the antibiotic use, there's no denying fact that antibiotic use has decreased the mortality due to sepsis. This is on one hand, but on the other hand, it has led to significant increase in allergic rhinitis, food allergy, atopic dermatitis, and other behavioral disease. Now, what happens? This is a nice paper. This is a nice paper published in 2021, and this is from America, where they studied 15,000 babies over 2 years. And their selection criteria was those babies should have received at least one course of minimum 5 days of any antibiotic, one course of minimum 5 days of any antibiotic. And you can see on the bottom slide that if you use penicillins, the incidence of asthma is significantly increased in both the genders, while ADHD is significantly increased in girls. Well, similar thing happens with celiac disease, significant increase in celiac disease in girls, and overweight, obesity with penicillins is significantly increases for both the genders. Similar thing also, you can see also cephalosporins, higher incidence for both the genders for autism, and a significant increase for girls in obesity as well as atopic dermatitis, sulfonamides, macrolides. So all those antibiotics, there was a significant and statistically significant increase, and they followed these babies up to 17, 18 years of life. And this was published in 2021. So how does antibiotic causes dysbiosis? So once you give antibiotic, it will phenotypically change your innate immunity, and there is abnormal formation of immune cells, which will decrease the activation of antibodies. And there is also disruption of adaptive immunity. So number and the function of plasma cell also goes down, and the mast cells produce more allergic reactions. And this will cause reduction in antibody production, leading to dysbiosis. So this paper is from a country where there's a stringent laws, there's a strict antibiotic policy. So you can imagine a country like us where there's a right, left, and central use of antibiotics, rampant use, and we don't follow those antibiotic stewardship program. We're putting our babies more at risk of ADHD, autism, obesity, putting a burden, not only economic burden, on families and societies. So why does there is a dysbiosis in preterm infants? Now, as you know, they are born prematurely, they have immature gut, and they have a lot of immune problems. And almost all of them have long hospital stays, and they are fed artificially, or they are fed a TPN, and they are almost always exposed to several classes of antibiotics and drugs. They undergo a lot of procedures. They are always fed by tubes. There are micro aspirations, multiple intubations, and all of these, they are exposed to NICU flora, which is not a healthy flora. And of course, not many hospitals and NICUs are supported by milk banks. So there's a less breast milk what they receive. And therefore, they have delayed bifidobacterium colonization, establishment, or stabilization. Their microbial flora is abnormal, and this abnormal microflora interacts with the developing CNS and causes white matter injury, which we'll see in the next slide. So coming to what is the function of that gut microbiota? So the chief functions of gut microbiota can be divided into three categories. They have metabolic functions, they have protective functions, and they have trophic functions. So in metabolic function, they cause fermentation of short-chain fatty acids and other end products, which is the fiber-related products. And they also cause energy salvage. They also are involved in vitamin synthesis and some mineral absorption. And if you look into their protective function, as I said, bifidobacterium is needed to prevent the adhesion of pathogens to the intestinal wall. They stabilize the intestinal pH. They also stimulate the production of bactericin. They cause maturation of enteric nervous system. And there is also secretion of antimicrobial peptides such as bactericin, as I said. And in terms of their trophic function, they regulate the differentiation and proliferation of intestinal epithelial cell. And there's an impact on neuroendocrine pathway, which also affects the immune system and homeostatic regulation. So there is a constant crosstalk between gut bacteria, the immune system, and the developing brain of the neonate. So what is gut-brain axis and how it is important? So gut microbiome, it influences the brain function and stress responses through the gut-brain axis communication. So it is crucial for the CNS development, which we'll see in the next slides. So there's indirect effect on tryptophan metabolism and serotonin synthesis. It also regulates the microbial homeostasis, which plays a vital role in fermenting carbohydrates, and also crucial for the development of normal hypothalamo-pituitary adrenal system. Remember, gut microbiome also plays an important role in maturation of HPA axis. So this is an important slide. So you can see there are the parallel development of GI tract and brain in the first 3 years of life. As we all know, the maximum, almost 80% of the brain growth occurs in first 3 years of life. And in previous slides, we just saw that the microbiome, which the establishment and the seeding, which starts at birth, achieves the adult level by 3 years of life. So there are significant parallels in the development of GI tract and brain in first 3 years of life. And you can see in terms of GI, the number of and the diversity of microorganism increases as you go towards the 3 years. The colonization, the diversity, the richness also goes on increasing. So is the number of crypts and villi. There's introcyte maturation, more innovation, and you can see there is a enteric nervous system which goes from more oligodendrocytes are formed in the enteric nervous system during these 3 years. And in parallel to this, the brain volume, which increases almost by 80% in first 3 years of life. There's a synaptogenesis going on, there's a myelination going on, there's a synaptic reinforcement, pruning of synaptic synapses, and there's also establishment of the auditory processes, visual processes, and formation of perpetual and memory function. So you can imagine if something goes wrong in either of these, So dysbiosis in the gut can lead to the simultaneous development or the parallel abnormal development of the brain. And similarly, if something goes wrong with the brain, it can also affect the gut microbiome, which is going to stay for a life with, which is going to stay with you for your life. So what is a gut-brain axis? So gut-brain axis is a complex network of interconnecting communication pathways between the gut and the brain. It is a bidirectional, dynamic, biochemical, and neural signaling pathways. So brain signals affect the GI functions, and the simultaneous visceral signaling from the GI tracts also affects the brain function. So what are the components? So important component of this bidirectional pathways are central nervous system, neuroendocrine or neuroimmune system, HPA axis, intestinal microbiota, sympathetic and parasympathetic autonomic nervous system, and enteric nervous system. So the microbiota plays a key role in this axis. So from this figure, you can imagine, you can see that gut microbiota produces lot of microbe-derived molecules. Now, these microbe-derived molecules act on the GI tract, which is on the right side, which acts on the gut connectome, which consists of immune system. It's a network of immune system, neuronal system, and endocrine system. So gut microbiota produces some metabolites which acts on GI tract. In response to this, the GI tract also produces some molecules. They are called as gut-derived molecules, which influence the composition and diversity of the gut microbiota. Now, this gut microbiota also indirectly in touch with central nervous system by some microbe-derived neuroactive molecules. Now, central nervous system, which is again has a limbic system in which through the autonomic nervous system, basically the vagus system, modulates the motility, secretion, and permeability in microbiome. So it is a bidirectional, neuronal, immune, and biochemical pathway. So this is elaborated further in this slide. So you can see on the lower side of this slide, there's a lot of microbiota, diverse community of microbiota, which produce entero or immune cells like cytokines, beta cells. They also produce, a lot of microbiomes also produce neurotransmitter. And they also produce some bacterial products like short-chain fatty acids, GABA, or serotonin, or tryptophan. And all of these will, the signals are sent to the central nervous system. And the central nervous system to the vagus and adrenal nervous system controls in response to this the secretion of non-adrenaline, and the non-adrenaline secretion also alters the microbiota composition. So it's a good immune neurotransmitter microbiota molecule related bidirectional biochemical and nervous axis. So let's see the different pathways of gut-brain axis. So first is hormonal pathway, which is HPA axis, and this axis regulates the production and secretion of cortisol, which influences the composition of the microbiota and vice versa. So if gut is stressed, the signals are sent to the brain, and it will control the secretion of cortisol. And if brain is stressed because of environmental factors, it also controls the composition and maturation of microbiota. And then there is a enteric nervous system pathway. So the vagus nerve directly communicates with the nerves that terminate in the gut mucosa. So signals from microbiota, the immune cells which are present in the epithelium, they are sent back to the central nervous system. So any products which are produced because of dysbiosis are directly sent, or signals are directly sent to the central nervous system. Then there is a blood-brain pathway. So the gut microbiota also can activate the neurons and glial cells located or terminated in the gut. So which results in electrical or chemical feedback to the brain. So a lot of neuroinflammatory cascades of pro-inflammatory cytokines such as TNF-alpha, interleukin-1b, and interleukin-1c are produced. And these pro-inflammatory markers can damage the developing brain. Now, some bacterial metabolites also produce short-chain fatty acids and neurotransmitters like GABA, serotonin, dopamine. So they are produced by gut microbiota, and they circulate to the blood and enter the brain via blood-brain barrier, and they can affect the simultaneous development of the brain. So what is the role of gut microbiota in gut-brain axis? So their role is through the short-chain fatty acid pathway, through the neurotransmitter pathway and through the cytokines and different mediators which are produced by this because of this dysbiosis, which transmit to the vagus nerve. So let's come to the short chain fatty acids. These are the products. These are butyrate, acetates, and propionates, and they're produced because of fermentation of dietary fibers. And human beings lack the enzymes required to digest these fibers. So these short chain fatty acids plays an important role in GI function. They regulate the glucose homeostasis. They regulate the mucosal serotonin secretion. Now remember that 80% of our serotonin is produced in the gut. The serotonin, which is a happiness hormone, is produced in the gut. So they also regulate the lymphatic function, and they have also role in the central appetite regulation. They influence the learning, memory acquisition via preservation of brain integrity. They modulate the blood-brain barrier permeability, and they also regulate the microglia activation and neuroinflammation. So these short-chain fatty acids are produced by microbiota. Now, what are the neurotransmitter pathways? So a lot of microbiota, as you can see in these slides, many neurotransmitters on your left-hand side, like serotonin, GABA, dopamine, norepinephrine, histamine, they are produced by a number of species which are there in gut microbiome. Like serotonin is produced by E. coli, Klebsiella, Candida, and its GI role is to regulate the gastric secretion and motility. And in brain, it plays the role of mood regulation by decreasing the anxiety and stress. Similarly, GABA is produced by lactobacilli, and it regulates the gastric emptying and motility. And the GABA regulates the memory and anxiety. So there are parallel roles of these neurotransmitters in gut as well as the brain. So dopamine and norepinephrine, they are produced by E. coli, some lactobacillus and proteases. And the dopamine regulates the motility, while norepinephrine regulates the blood flow by causing vasoconstriction. And dopamine also plays important role in the brain in controlling the voluntary movements and inducing the feeling of pleasure, while norepinephrine controls your motor, emotions, and endocrine modulation. The histamine is also produced by lactobacillus and pediococcus, and it causes the enhancement of gastric acid production and regulates wakefulness and motivation. So through this slide, we know that these neurotransmitters, previously we used to think that they have only role in the brain, but they also have a role in gut. And this proves that this axis is an important for the health of the human being. Now coming to the implications, what are the implications of this MGBA? This is microbiota gut-brain axis. So it plays an important role in white matter injury, which is a very important neurological disease of prematurity. It also plays an important role in necrotizing enterocolitis, late onset sepsis, and autism spectrum disorders, obesity, inflammatory bowel diseases, irritable bowel diseases, asthma, allergy. And you know that the schizophrenia is associated with preterm birth and some changes, dysbiosis in the gut. So microbiota gut-brain axis is involved, especially in the preterm babies. We are talking about the preterm babies for their brain white matter injury, necrotizing enterocolitis, and late onset sepsis. Now, you know that the incidence of necrotizing enterocolitis and late onset sepsis is more than combined incidence of childhood cancers, all the childhood cancers. There's a 30% babies in India born preterm. And this necrotizing enterocolitis is unfortunately, since last 30 years, we haven't made any progress in terms of the management. And it has a long-term complication. Almost 30% of the babies who are diagnosed with NEC develop cerebral palsy. 10% of them become mentally retarded. 13% have audiovisual impairment and motor retardation. And how this microbiota can affect injury, can affect white matter injury. So it can affect, because of NEC, there's a dysbiosis in the gut, and these abnormal metabolites which are produced, they can affect the white matter through the cytokines, through the oxidative stress, and propagating the formation of pro-inflammatory markers. So as I said, the intestinal dysbiosis and intestinal inflammation which occurs in NEC, the signals travel to the enteric nervous system, which is in the intestinal wall or to the vagus nerve, to the central nervous system. Also, the bacteria produce a lot of lipopyrrosaccharides, and these are the microbial toxins which are the pro-inflammatory cytokines and free radicals, and they can directly or indirectly cause brain injury via gut-brain axis. So combination of all this local lipopolysaccharide production as well as to the pro-inflammatory markers and a lot of abnormal neurotransmitters that results in white matter injury, which is depicted beautifully in this slide. So on the left-hand side, you can see there is short chain on step 1, a lot of short chain fatty acids are produced because of the microbial dysbiosis, and which can cross the barrier, intestinal barrier. And there are also neurotransmitters, active neurotransmitters, which are produced. This increase in short chain fatty acids will cross the blood-brain barrier and go to the brain, and then the developing microglia, so they cause a lot of pro-inflammatory cytokines release, which can damage the which can damage the microglia, and that can lead to abnormal oligodendrocyte formation, and that leads to hypomyelination and brain injury. Similarly, through the lipopolysaccharide pathway, which is on your right side, through the HBMB genes, so these are homeobox genes, which are pro-inflammatory genes. They release a lot of pro-inflammatory markers like TNF alpha and interleukin 1 and 6 that directly can enter into the via the blood-brain barrier to the brain and cause developing brain injury. So through these steps, microbial dysbiosis not only causes the developing brain injury, but also causes the dysbiosis which stays there for almost so it has been documented that this dysbiosis can in NEC patient can stay up to 7 years of life. So scientists have documented that it takes almost 7 to 10 years to establish adult-like flora for those babies who are born prematurely and have incidence of NEC. So what are the implications for health and practices? So late onset sepsis, dysbiosis, because of the intestinal dysbiosis, there's an increased incidence of late onset sepsis, which is another important morbidity for the preterm infants, which can cause white matter injury. Now, this gut dysbiosis also contributes to allergy, asthma, obesity, inflammatory bowel diseases, celiac diseases, IBS, metabolic syndrome, and cardiovascular disorders. And schizophrenia, as I said previously, has been positively associated with preterm babies and microbiota changes. So let's come to the role of gut microbiota in developmental disorders. So as you can see on the left side, on the right side, you have preterm infants. On the right side, you have term infants. And on the right lower side, you can see the gestational age from 25 weeks to 50 weeks. And those colors are for those organisms. So for 25 to 35 weeks, you have Enterococcus, then Staphylococcus, and then 35 to 40 weeks, you have Enterobacter, and then Streptococcus. So in preterm infants, because of their gestation, because of lack of breast milk, because of use of antibiotics, prolonged hospital stay, there's a decrease of diversity. So you have decreased Staphylococcus, decreased Enterobacter, decreased good Bifidobacterium, which leads to decreased Bifidobacterium and increased Lactobacillus. And this all together will increase the levels of phenylalanine and GABA, and which will alter the developing brain structure in such a way that they later on go on to develop ASD, autism spectrum-like disorders. While in term infants, on left side, you can see that there's a healthy, it is colonized by healthy bacteria like Bifidobacter, Enterobacter, and Streptococcus, which produce tryptophan and GABA in a normal amount, and which helps in development of a normal brain. So coming to autism spectrum disorder, a lot of research in recent, since last 2015, has gone on towards the role of gut microbiota in autism spectrum disorders and ADHD. Now, these patients, ASD patients and ADHD patients, have almost 40 to 70% of these patients have gut-related morbidities. You probably must have seen that ASD patient, they don't eat, they need this thing, a pest type of food till 2 years of age group. They don't chew well, and they have a lot of gut dysbiosis. And their dietary patterns are also abnormal in terms of their normal implantation of Bifidobacterium. And this alteration in the gut microbial profile was studied extensively, which scientists have shown that there's a reduced abundance of Bifidobacterium and increased abundance of Clostridia. So if you decrease Bifidobacterium, you can imagine what will happen to the they have repeated gut-related symptoms and increase incidence of Clostridial difficile infections. Now, few trials have documented that treatment with vancomycin. I don't suggest that you should do that. These are the small number of trials, but treatment with picomycin have resulted in positive alteration in behavioral symptoms, highlighting the role of aberrantly altered gut microbial profile in ASD. So this was a promising trial. And then how many of you have heard of FMT, that is called as fecal microbial transplantation? So fecal microbial transplantation from a healthy individual into the ASD patient. So what do they do? That you take a fecal microbiota from a healthy individual, either by colonoscopy, by NGT tube, either through the juices, or typical capsules which are developed. You can administer to ASD patient, and that has led to improvements in some behavioral aspect. These are few number of trials, but promising results have been seen. In the next 5 years, you'll be able to see that you can say that almost 30 to 40% their behavioral problems can be reduced only because of FMT. So what are the implications in terms of maternal diet? Now, we all know that maternal diet can alter the fetal microbiota. Stress during the mother can change the vaginal pH and decrease lactobacillus, and which have a significant impact on transmission of those vaginal or maternal microbiota to the neonate. So there is abnormal seeding. SSRI, so serotonin reuptake inhibitors. The exposure of fetus to SSRI during pregnancy is manifested by delayed developmental milestone in infantile speech, behavioral problems after infancy, and a lot of these babies have eating disorders and altered motor activity. So antibiotic administration during the pregnancy has led to increased incidence of asthma, obesity, all as well as there's increased incidence of NEC in neonates. And there's also increased incidence of celiac disease, which has been seen with antibiotic administration during pregnancy. So in all units, we need a strict antibiotic stewardship to prevent the long-term behavioral problems in this baby. So what is the implication for health and practice in terms of neonatal nutrition, how we can modify the GBA function? So nutrition is not mere only administration of nutrient. It is more than that. So nutrition consists of nutrients which we administer as fat, micronutrients, proteins, and the functional components of it, like human milk oligosaccharides, which are the third largest product which is found in breast milk, which has a prebiotic actions. Then there are a lot of growth factors, enzyme, and then microbes, the breast milk environment, the probiotics, the prebiotics, which we administer, and the technique and the social behavioral aspect of it. All of this together forms nutrition. It's not mere administration of nutrition. So as we know, and this is a cliche, that breast milk is best for the baby, but mother's own milk is best for the baby, own mother's milk. So the fresh colostrum and the milk contains lactoferrin, lysozymes, immunomodulatory agents, which prevents the incidence of NEC. Now remember, this breast milk has a high concentration of bifidobacterium, and which we saw that it inhibits the adhesion of pathogens to the intestine and also improves the gut immunity. So the breast milk has human milk oligosaccharides. So a lot of research has shown that there are more than 200 types of different HMOs, and they are the third largest product, and they prevent NEC through their prebiotic action. They prevent the adhesion of pathogenic bacteria, and they also stabilize the intestinal pH. Now, the feeding probiotics to very preterm infant has also reduced the occurrence of NEC. Number of trials have shown that. And the probiotics not only prevent berry injury by blocking the transport and damaging biomolecules via GBA, but also they decrease the incidence of NEC, which can indirectly cause the white matter injury. So why is poor nutrition so common? Because our focus when we are treating in our body, our babies in NICU, is a robotic care what we give. We do not give them holistic care. So our focus is on numbers, what we can see and what we can measure. So we measure tidal volumes, we measure what are inspiratory and expiratory pressures we are giving, we measure blood pressures, we measure blood sugar level, we measure serum bilirubin levels, but we don't measure, there is no machine with a loud alarm if nutrient intake is adequate. So malnutrition is always invisible in this. So what we can do? So these are the 8 or 9 practical ways to improve the gut health in preterm babies. So we need to educate our healthcare fraternities for the zero separation. Zero separations means that we should allow the baby to born on mother's abdomen, then allow to have breast crawl, start breastfeeding within 5 minutes, and delayed cord clamping. So we need to educate our healthcare facility. We need to promote breastfeeding as early as possible, minimize the use of antibiotics, H2 blockers, and start breastfeeding on 0-1. We encourage the KMC, and we should also do evidence-based practices. We should reflect and think about how we can do NICU audits, form antibiotic stewardship guidelines, and improve the outcome for those babies. So in summary, I would say that the process of microbial colonization and cognitive development coincides in the first year of life. Remember, the humans have the largest brain as compared to other primates. It almost 10 times more than the body surface area. So during that 3 years, it is very important that the process of microbial colonization is healthy, the seeding is normal. And that normal seeding can influence the immune functions and metabolic functions, and ultimately may have an impact on the brain development and behavioral outcome. So gut-brain axis it's a complex network of interconnecting communicating pathway, which we just saw through the neurotransmitters, through the metabolites, through the HPA axis. Now, dysbiosis of infant microbiota may generate altered patterns of microbial metabolites with detrimental effects on CNS development. Now, breast milk have a potential role in the development of myelination pattern of vagus nerve. So those babies who have breast milk, their myelination pattern, and vagus nerve is called as a sixth sense. So the myelination pattern of vagus nerve is different in breast milk babies than formula-filled babies. And it also have a positive effect on production of hormones in GI tract. And it is important to recognize that microbiome may be a key contributor to the prevention of development, treatment, and management of CNS diseases like Parkinson's, Alzheimer's, and multiple sclerosis. Whereas something as simple as everyday diet, the simple pill of fecal microbiota transplant can pose significant therapeutic potential, especially when synergized with existing therapies. Thank you very much, and these are my references.
Thank you, Sudhir sir, for such an informative lecture. Now I request Dr. Shailaja madam to start the next session, that is on applied physiology of lactation.
Good evening, respected and dear all. Sudhir, will you please stop sharing the screen so that I can share? Yes, 1 second. Is it visible?
Madam, make it full screen, ma'am. Yes, ma'am. Now it's okay.
Good evening, respected and dear all. At the outset, I will like to thank Maha Subspeciality chapter of Maharashtra IIP and the entire team of CIAP, team of Maha IIP, team of CIAP EB members, and team of all the coordinators, particularly Dr. Ramakant Patil sir, Dr. Samir Sadavarte, Dr. Sachin Patil, Dr. Sachin Gaikwad, Dr. Pallavi, and entire team. I highly appreciate your initiative, and you really are doing great work, and please keep doing it. All the best, and thanks a lot for invitation for this important platform and making us share our views in various topics. So I will starting with this is simple topic, but this is of practical importance. So lactation everyone knows, but what is applied physiology? We'll cover it now. So I will start with anatomy of the breast. This is just revision for all of us. So it is located from 2nd to 6th intercostal space. So what is the importance of it? Whenever we are having any patient who is maybe a small child, girl child I'm talking about, or any adolescent girl, when we need some intervention like putting up ICD for any indication. So we should be careful while putting this ICD because it can sever the nerves and vessels, and it can lead to failure of lactation in later life. So we do not consider this point at all. Till I became IBCLC, I also had never thought of it. So whenever we are putting ICD in girls, we should be careful. And sizes of the breast depends upon the fat composition, and it is not having any relevance, any correlation for the amount of secretion of milk. And weight varies before non-pregnancy. It is before pregnancy it is 200 gram. During pregnancy, obviously it increases, and during lactation it is up to 800 grams even. And every breast contains 15 to 25 lobes with 10 to 100 alveoli in each lobe. Parenchyma, of course, contains the functional part, that is alveoli of the breast, and secretory component, that is lactocyte and myoepithelial cells for secretion, ejection of the milk. And stroma is the supportive tissue of the breast. So this is primary reach. We all know that it starts from the mammary reach, starts from 4th to 5th week of gestation, and this is milk line, which goes from extends from axilla to groin. So we can have any anomaly of the nipple, duct, or even glandular tissue can be seen. Accessory nipple or accessory mammary tissues can be seen along this line. So whenever we are having screening for the anomalies, particularly at newborn period, we should think over it. And these are the types of anomalies: type 1, type 2, type 3, and type 4. Type 1 is hypoplasia of the lower medial quadrant. Type 2 is hypoplasia of the lower medial and lateral quadrant. And type 3 is hypoplasia of both these quadrant with skin deficiency in the subareolar region as well. And type 4 is severe breast constriction with minimal breast tissue. So this patient will not have or will have minimum amount of secretions from this particular hypoplastic breast. So polymastia is presence of extra breast tissue. Hyperthalia is nipple without accompanying mammary tissue. Hypertrophy is abnormally large breast. Hypomastia is abnormally small breast. Hyperplasia is overdevelopment of breast. Amastia is absence of breast tissue, and athalia is absence of nipple tissue. So this is Tanner stage. All of us are aware of it. There are 5 stages. This is pre-adolescent stage 1, breast budding. Initially, I will not go into the details to save the time. This is stage 2. Continuation of enlargement with contour. This is stage 3. Areola and papilla formation is stage 4. And mature female breast is stage 5 of the Tanner stage. And these are the 4 quadrants. This is tail of Spence. You can see, this is the actual photograph of our patient. You can see the enlargement in the axilla, which is many times these girls or mothers are anxious. What is this happening? And whenever there is some swelling in and around the breast, they are always having anxiety about the cancer. So we should tell them that this is tail of Spence or tail of the breast, and this is extension of the mammary tissue. And whenever congestion is reduced, it will reduce. So it is a normal projection. It should be distinguished from the supernumerary breast tissue as well. So development of breast occurs in due to various hormones. So hormonal influences starts from prepubertal period, that is estrogen, progesterone, ACTH, thyroid stimulating hormone. All these are hormones active for the prepubertal period. During puberty, establishment of hypophyseal, ovarian, and uterine cycle, which is controlled by, of course, estrogen and progesterone. During pregnancy, there is increased ductular branching and lobular formation due to HPL axis. There is increased growth of alveoli and lobes due to progesterone, estrogen, and prolactin. And of course, there is later on increased growth. Dr. Mandar, can you please mute yourself? There is increase in growth and differentiation of alveoli and ductal structures. So nutrition diet is. Host, can you please mute the disturbance? Hello. Hello.
Pallavi madam, please mute that delegate. Pallavi madam. Pallavi madam.
Pallavi madam, mute everybody and then unmute madam.
चप्पल नाही घातली का तू सायकल जाऊ दे पुढे.
So coming to the types of nipples. So this is the normal nipple. When we are looking at from lateral side, this is little bit project is normal. This is flat and this is inverted. You can see this is inverted, but we should not make our opinion only by inspection, because nipple is a having projectile tissue in it. So nipple pinch test should be done. So in both this C-shaped fingers should be curved around above the area of areola where it is practically shown in this photograph. And after pinching, if it is even inverted, then only it should be taken as inverted. And still we are able to latch properly. It is not necessarily that every patient will have problem, because it is not nipple feeding, it is breastfeeding. So maximum part of areola should be given in the baby's mouth, and slowly this nipple will start protecting outside. But if required, we can take little bit for shorter period of time if required with nipple shields. Each and every patient will not need of it. It should be case to case, and it should be temporary and temporary only. So there are various reflexes which are required to set at normal in mother and in baby. So prolactin reflex and oxytocin reflexes are the two main important reflexes for the mothers. What are the enhancing factors? Early initiation of breastfeeding, good attachment, good effective suckling, frequent feeding, particularly night feeding is required, and emptying of the breast. This is very, very important point, emptying of the breast. And then what are the hindering factors? Delay in the initiation of breastfeeding, prelactal feeds in any form, bottle feeding, incorrect positioning, and painful breastfeeding. So we all know prolactin reflex. I will not go into the details. Second reflex is oxytocin reflex. It is again stimulated by things which are looking at the baby, sound of the baby, even photograph of a baby, thoughts of even baby. Then confident mother. It is also important, and it is inhibited by worry, stress, pain, doubt. That means we should give support, psychological support and counseling to the mother in order to establish and continue the breastfeeding. That is very important and essential point, which we are not able to take care practically in our daily routine practice. Two reflexes are important in baby. Suckling reflex. Whenever baby suckles, that stimulates all the reflexes of the baby also. And feeding reflexes, which is important, is rooting reflex, sucking reflex, swallowing reflex, gag reflex. And again, baby has to learn, and though it is natural, few times we have to help the baby as well. So starting with the applied physiology, it is required for neuronal growth. Various neuronal growth factors are there which are required for brain development in the baby, particularly dendrite development. Angiogenesis occurs due to various factors which are there in the vascular endothelial growth factors in the mother's milk, and they are helpful for the angiogenesis. Then hepatocyte growth factors, which helps for the maturation of various organs, epidermal growth factors, which helps for the maturation of various organs, and insulin-like growth factors, particularly they are important for erythropoiesis. So mother's milk is not only nutrition, but it is having innumerable benefits. Coming to lactogenesis, there are various stages of lactogenesis. I will like you to concentrate on this photograph first. That is milk formation. That is lactogenesis 1, from birth to 2 to 5 days of delivery to 2 to 5 days. Then lactogenesis 2 begins from 2 to 5 days after birth, and it is particularly required for the increased development of the milk. And then lactogenesis 3, which begins after 10 days of birth. So lactogenesis 1 2 to 5 days, that is milk formation begins. Lactogenesis 2 2 to 5 days after birth, and volume of milk is increased. And lactogenesis 3 after 10 days. So stable quantity of milk starts after that. So initial 5 days are very, very important for the establishment of lactogenesis. So synthesis and secretion of milk occurs from the mid-pregnancy. So particularly after 6th to 7th month of pregnancy. And mammary secretion cells are stimulated by prolactin, and they produce the milk. Milk secretion starts after 16th prenatal week. That means antenatally. So what is the application practically of it? That colostrum which is early milk, which is available for the infants, and antenatal expression of small doses of small quantity of colostrum, particularly whenever we are suspecting that any mother might go into premature level, particularly mothers with diabetes, they can have delay in the lactogenesis. So we can, of course, with the consent of the treating obstetrician, and it has to be gentle and case to case and not a generalized blanket practice. But we can collect the small quantity, small drops. I can say pulse of drops of amrut, which is important for the newborn premature baby later on. We can feed, we can express, store, and feed. I will show the photograph later on. And lactation suppression is required if the mother is having any sad incidents of abortion or IUD, and that has to be taken care of. So coming to composition of the milk. So colostrum contains antibody-rich solution. It is antibody-rich, and then many white cells are there. It is also a purgative action, various growth factors, vitamins, and it is also rich in vitamin A. So what is importance of it? It protects against infection, allergy, in various GI infection, respiratory. Hello, am I audible?
Yes, madam. Yes.
It helps to clear the meconium, and it helps to prevent the jaundice also. It helps to help the intestine to mature and prevent the various allergies, intolerance, and gut-brain axis establishment as well, which is already discussed by Dr. Sudhir. It reduces the severity of infection, particularly respiratory and serious infections like measles, diarrhea, and vitamin A is important for the eyes as well. Then it is very dynamic actually. So from preterm to full term, composition changes. From stages of lactation, colostrum to mature milk, again composition changes. And during the feed also, pour milk and hind milk composition again changes. You can see here in this photograph, this is pour milk and this is hind milk. Pour milk is more watery and hind milk is having more thicker components of it. To name few, colostrum is perfect first food for the baby, and the first few days of feeding may only have small amount, but the colostrum is already rich in various nutrients and antibodies to keep baby healthy. So like all breast milk, the colostrum color may vary, but the milk is commonly known as liquid gold. That is liquid gold which cannot be produced in any laboratory. So pour milk is whenever mature milk starts. Pour milk is initial part of the milk secretion, which is to quench the thirst of the baby, which is high in lactose and proteins, but contains very little amount of fat and calories. And too much pour milk can cause gassiness in the baby and green potty. So whenever mother is feeding only for milk, if particularly mother is feeding from both breast at each time, baby will receive only for milk, and baby will have gas problem, colic, and baby will not gain the weight. Baby will be always hungry, irritable, and baby will have green potty. So that means mother is feeding mainly for milk. Hind milk is whenever pour milk is reduced, and then hind milk starts. It is mature milk, and it is a lot of fats and calories. Although it is there is no clear demarcation between pour milk and hind milk. Later on, during the secretion, during the feeding, baby will be receiving the hind milk, and which is more thicker and dense, and it will help for the weight gain and to satisfy the hunger. So we have to tell the mother that at each feeding she has to give breastfeeding from only one breast, and for next feeding, next breast, so that baby will receive both pour milk and hind milk, and all other problems of the baby will be solved, and weight gain will be there. Baby will sleep properly also. Coming to next stage of lactogenesis, it starts from 30 to 72 hours after delivery of placenta, and it is triggered by the rapid drop of progesterone levels after delivery of the placenta. So what is the applied application of it? Maternal conditions that can delay this lactogenesis is antepartum factors like primea gravida, diabetes 1 type 1, particularly obese mother, PCOS mother, thyroid, hypothyroid mother having any cyst, luteal cyst, isolated prolactin deficiency, breast surgery, particularly in India also, we are now able to see few cases of breast reduction surgery, breast augmentation surgery, which can happen. during adolescent period or early adulthood period for the cosmetic purposes, but later on, whenever they are having lactogenesis, it will create problem. Particularly intrapartum factors, C-section, prolonged second stage of labor, if there are some bits of placenta which are retained, then maternal fluid overload, particularly during the labor, if the obstetrician is giving lot of fluid, that is also a hindering factor. Then particularly labor analgesia, painless labor nowadays, many people are demanding. So these are all hindering factors. And postpartum factors like retention of placenta, Sheehan syndrome. Sheehan syndrome is bleeding of the pituitary, bleeding in the pituitary. And of course, stress. These are the hindering factors for the establishment of lactogenesis. So what is the role of prolactin? Frequent feeding in early lactation helps to develop the prolactin receptors. So mother's breast is having limited number of prolactin receptors, and one has to stimulate it for the proper functioning of the prolactin receptor. And that happens particularly within 48 hours of the delivery. After that, that activated number of prolactin receptors gets fixated. And later on, even if we try, mother may not have adequate quantity of milk. So breast crawl should be started immediately, and KMC should be started, skin to skin contact. You can see here, these are the actual photographs which are taken at our center. This is the KMC, this is the breast crawl. Early initiation and early latching helps to activate these prolactin receptors, and 8 to 10 times breastfeeding or milk expression. If mother is having premature delivery, baby is in NICU or baby is small or whatever condition. So 10 to 15 minutes expression should be done by hand expression or by pump or combination of both, particularly in premature delivery, whenever is there was a mother and baby is separated due to any reason. So it helps to establish exclusive breastfeeding in later on whenever baby is properly able to take. So premature mothers must start their expression within 1 hour, particularly like a normal delivery, and they should continue daily 8 to 10 times expression, no matter whether milk is coming or not. We have to continue stimulation of the breast and to form all these reflexes and stimulation and this activation of the prolactin receptors, which is most of these times neglected factor. And at our center, we have taken a lot of efforts, and these babies will have get benefit whenever they are able to take it, maybe at least express breast milk, and later on direct breastfeeding. Coming to galactogenesis, it is maintenance of lactation, particularly prolactin and suckling are essential for maintenance, and it is controlled by autocrine system. Till now, we have seen endocrine system. So what is application of it? Adequacy of lactation can be assessed by stooling frequency, which I will discuss later on. Good positioning helps in maintenance of lactation and reduces the incidence of nipple pain, nipple trauma, mastitis later on, and then breast abscess, of course. So there are factors like feedback inhibitors of lactation. They are whey proteins which are synthesized by lactocytes. Whenever there is breast congestion and inadequate expression of milk, this FIL comes into factor, and at certain amount that secretion of milk is fixated by nature. So key points for the positioning are: mother should sit in comfortable position and convenient position, whatever she is comfortable with, and ensure that she is relaxed and comfortable. And baby is having that 5 points. Baby's head and body should be in the straight line. Baby's whole body should be supported by the hand. Baby's face should be turned. Face is opposite to should be opposite to the nipple, and baby's abdomen should touch to the abdomen of the mother. So skin to skin contact will be there. So these are few facts about the breast milk secretion and baby's capacity of the stomach. So absolute amount of colostrum is really very small, maybe 5 ml, 4 to 5 ml at a time, and high viscosity is there, but it is for the genuine reason by the nature, because on day 1 size of the baby's stomach is 5 to 7 ml only. That means 1 te sawa chamcha. So but the small size of the cherry. So baby is also learning in the learning stage. So nature had given small quantity so that sucking, swallowing and breathing will be coordinated and baby will not choke. So it helps baby to practice the sucking, swallowing and breathing, and it prevents from choking if there is large quantity, particularly when it is given from the top feeding. They are giving half watty and whatever by spoon and whatever container. And volume is as per the newborn stomach size. And breastfeed babies produce more ketone bodies for the brain to utilize, so that hypoglycemia is avoided. So instead of getting scared of hypoglycemia, we should try to establish breastfeeding properly. On day 2 to 3, there will be size of walnut, that is 25 to 27 ml, that is 1 ounce. 1 week, it will be size of apricot, 50 to 60 ml, 2 ounce, 1.5 to 2 ounce. And at the end of 1 month, it is of a larger size of egg. So 80 to 150 ml at a time baby can take. These are the facts proven by the many research work, and we should think over it, and we should apply it practically whenever we are advising feeding. You can see this is practically collected antenatal collection of the breast milk secretions, and we have to store it in the insulin syringe also we can take, or tuberculin syringe also we can take, and in zip pouch we should label the date, and each and every syringe should be sealed, and we should collect it and keep it, store it in a zip pouch. So this is colostrum, which is important for new babies. This is fore milk, which is rich in water. And this is hind milk, which is rich in fat and calories. You can see the color difference in 4 of them. So there are various pathways, that is local production pathway and systemic production of pathway. This is particularly for immunity. B cell induced in mucosal site, then transport, and then homing in the mammary gland, and it is secreted as IgG. So IgG in systemic compartment, and there is filtration of from the plasma and secretion of systemically produced IgG. So mother's milk is having IgA, secretory IgA, secretory IgM, IgG, IgA, and IgM and G in systemical pathway as well. Another part is practical importance is we must encourage breast pumping or breast expression manually in preterm delivered patients. Particularly this patient, you can see this patient is in ICU due to her health issue, but we have to continue expression at there also, so that she can continue her secretion for her baby later on. These are the breast massage before expression of the milk. This is the massage of the breast, which is to be done by 2 pulp of the fingers and in round strokes. You can see we should start from armpit because there is tail of the spines, and by rotation we have to cover all the quadrants, particularly down here, because it can get congested. And then we have to use gentle strokes from back to ahead, back to front, and then we have to roll this thumb back and front, so that it will help for ejection of the milk. Starting with the storage of the milk on the countertop, particularly in Maharashtra, this area, we can store for 3 to 4 hours. It should be, of course, covered. An insulated cooler bag for 24 hours. Refrigerator, it should not be stored more than 4 to 5 days. In freezer, deep freezer, we can save for 3 to 6 months if it is particularly for storage and not from the home fridge, and because it is minus 20 degrees Celsius. And many mothers can express extra milk and store it, and they can utilize it if they are doing storage properly, or they can donate it to milk bank. And we are getting many mothers calls who are helping us to collect the milk and give it to the needy babies. So breast milk contains lot of things, organisms and cells, particularly viruses, bacteria, fungi, immune cells, stem cells. Already gut-brain axis is discussed. Various nutrients, particularly at perfect quantity and perfect type: carbohydrate, lipids, fatty acids, proteins, amino acids, minerals, vitamins, various bioactive components, particularly HMOs, human milk oligosaccharides required for the brain, lactoferrin, hormones, immunoglobulins, cytokines, then extracellular vesicles, metabolites, glycoproteins. So breast milk lactocytes are very important cells, and it helps both mother and infant's health is established. Mothers particularly are helpful for the reduction in the NCDs, infectious disease and growth and development in the babies. So various factors are important which affect particularly maternal age, diet, physical activity, stress, various medication, alcohol or smoking. In early life, gestational age, parity, what is the lactation stage and mode of the delivery, environmental and social factors. I will not go into the details, but it helps and affects the secretion of the milk. So preterm mother's milk is to be given to the preterm baby, and I will just show how it is different. Preterm mother's milk is own mother's milk should be given preferably. If it is not possible, donor preterm mother's milk should be given to the preterm mother's milk. At our center, in our milk bank, I am storing it separately. Preterm mother's milk, full term mother's milk, colostrum, then within first 48 hours, 72 hours, and then 7 days and 1 month, like that. And whenever there is requirement from NICU, we try to provide accordingly, because that is having perfect combination and perfect components which are required for protection of the baby. Preterm mother's milk contains lot of antibodies than term babies, and it is having higher concentration of certain nutrients, particularly protein, sodium, iron, and chloride. And whenever we are giving donor mother's milk, it may kill lot of live cells. So of course, the sequence should be mother's own milk. If it is possible, direct breast milk. If it is not possible, express breast milk, but mother's own milk. If it is not possible, third best choice is PDHM, pasteurized donor human milk. So this is the sequence we must remember. So what are the signs for proper attachment? This is mouth should be wide open, more than 130 degrees Celsius, 130 degree angle of the mouth should be wide open. It is not nipple feeding, it is breastfeeding. So maximum part of areola should be there in the mouth of the baby. Lips should be everted, and there should be correct latch on. So this is correct latch on. This is only nipple feeding. It will injure the mother's nipple, and it can cause the gateway of India for infection. So we must give this information antenatally if possible. That is the best stage, because mother is in receptive mode. Because after delivery, she might have pain here and there, and she may not be able to give full concentration. And whenever mother is having extra milk secretion, we can have feeding or hands-on pumping. This is called as hands-on pumping. So she can store from the other side, or she can express from the other side. These are various positions: cradle position, cross cradle position, football hold, then laid back position, side lying. Whatever position is comfortable for the mother, she can feed. But there are certain conditions in the baby, particularly hypotonia, dancer hold method, and all those things. But particularly hypotonia, Down's baby, or certain anomalies, we have to give in particular position. So you can see this is bleb. This is nipple injury. This is cracked nipple. It can create problem, mastitis, and infection later on. So how to judge adequacy of lactation? Only 3 criteria. Wet nappies 8 to 10 times a day. Pre and post feeding weight can be done if baby is always cranky and not able to give proper sleep also. And weight gain, particularly after 10 to 12 days of life, 20 to 30 gram per day. And newborn nappies observation is the best criteria for the adequacy. So what to expect on day 1? At least 1 wet nappy, and it should be meconium, that is thick black sticky potty. That is day 1. On day 2, number of wet nappies should be 2. Wet means with stool, I am telling, and it should be of less meconium. Day 3, 3 nappies, easy to remember: 1, 2, 3. Black color, less black color. And day 3, it should be softer and greenish brown in color, which is called as transition stool. Day 4, at least 4 nappy, and wet nappy should be lighter green, it should be mustard color, or it should be CD in appearance. And day 5, on day 5, baby should have at least 5 times motions, and it should be yellow liquid. मी साध्या भाषेत सांगते, तुम्ही माझ्यावर रागवाल, परंतु महाराष्ट्रीयन पिठल्यासारखी कन्सिस्टन्सी, म्हणजे सेमी सॉलिड आणि त्या कलरची कन्सिस्टन्सी. So simple to remember. Day 1 to 5, 1, 2, 3, 4, 5 nappies. Initially it should be black, then greenish, then less green, black, brown, and day 4 CD and brownish, and day 5 pitlasarki nappy. And if any baby is not having the transitional stool, that this is called as breastfeed stool, that is golden yellow stools are breastfeed stool on day 5. If any baby is not passing, that means that baby is not having adequate breastfeeding, and that baby can develop jaundice, because we all know how jaundice develops. And if baby is passing the potty properly, that baby will not have jaundice properly. So this is the easy sign, easy assessment, which can give lot of clues, but we all doctors are not giving attention to it. So I request all to please have a look at it. This is practical, actual colors of the nappies: black colored on day 1, soft green, black on day 2, then greenish brown on day 3, brown yellow on day 4, and yellow, golden yellow on day 5. So already we have discussed about FIL, feedback inhibitors of lactation. So inadequate emptiness of breast leads to FIL and improper latching, and it can lead to failure of lactation later on. So we have to decide and observe about what is the full breast and what is engorged breast. Full breast usually occurs after 72 hours. So for first 3 days, there will be less volume of milk, but which will be important for the continuation of lactation. So if the full breast is there after 72 hours, it will be hot, heavy, or maybe even hard, and milk will start flowing and fever will not be there. That is full breast. That is initial stage of breast congestion. But if there is engorgement, it can occur at any time after 72 hours, and it will be painful. There will be edema, pitting edema on touching the breast. It will be tight, particularly, especially nipple area will be shiny, and there will be, it may look red if there is mastitis. Milk will not start flowing there, and mother may have fever, and see, it can lead to mastitis and breast abscess. So we have to act fast at the stage of full breast and maximum engorgement stage, so that mother will not have a problem of mastitis, and ultimately baby will not face any problem for the breastfeeding. So this is engorged breast. You can see this is normal red area of her breast, but this is mastitis. You can see edema, shiny skin, and all engorged vessels also. And this is breast abscess. You can see these are actual photographs which I have managed in DY. And then we have to sometime, I'm very happy to tell here that since last 10 years, not a single mother of our institute had breast abscess, but we are getting a lot of references, particularly after COVID. During COVID, we have seen many mothers with breast abscess which were referred, and nowadays we are having referrals from outside, from doctors and on their own also. You can see that this breast is treated for the breast abscess, and we are usually avoiding breast surgery, and we are doing ultrasound guided breast aspiration of the breast abscess, and we have to continue the expression of the milk and feeding of the milk to the baby. And if baby is full term, then only. If baby is sick, premature, we should not give, but from the other side we can safely give. And we always try to continue the breastfeeding, even breast abscess is drained by syringe, or even sometimes they come at late stage, lot of volume is there, then we have to give incision and drainage. But our surgeons, we have sensitized and requested that they should give the incision away from the areola, so that we can express the milk from the breast properly. And minimum severe injury to the duct and nerve should be done, so that we can continue the secretion of breast milk from that particular side. So this is KMC, which also helps. You can see this tiny baby from the NICU. That is helpful for the secretion stimulation. So premature babies are having various issues. I will not go into the details, but the solution is to continue the breastfeeding. Even colostrum, few drops, mouth painting should be done, and it can be done even in the ventilated babies, because gut-brain axis will develop, and it will develop to help the immunity and reduce the NEC incidence. So how baby sucks the breast? It is facilitated by the negative pressure in the oral cavity and positive pressure of the tongue against the teeth, and there is increased intraductal pressure. So neuroendocrine control, milk ejection, these are the all interrelated mechanisms. So there is coordination between sucking, swallowing, and breathing, 1:1:1 sequence in the proportion, and swallowing coincides with the cessation of the nasal airflow. So transient immature sucks will be there in premature babies, particularly 3 to 5 sucks, and burst of the sucks, and followed by swallow. Later on, 10 to 30 sucks and then swallow. And on an average 16 to 17 sucks, followed by at the age of 1 month, and followed by around 30 to 32 sucks at the age of 6 months. So they will suckle, and they will swallow and breathe. And that is normal pattern. Many mothers who are particularly caring and educated, they will complain that baby is sucking, and then baby is swallowing. Is it normal or not? We should know that. So what is suckling and sucking? Sucking means by which the infant takes nourishment. So milk is actually going, that is suckling, and sucking is drawing of food into the mouth by rhythmic movements. So immature suck is 3 to 5 sucks in burst, and mature suck is 10 to 30 sucks in the burst, and then swallowing. So what is nutritive suckling and non-nutritive suckling? Nutritive is sucking to obtain the nutrients, and it occurs purely in presence of oral fluid. That means milk will be there. So about 1 suck per second will be there. NNS, non-nutritive suckling, particularly there will not be any nutrient flow, particularly in premature babies and tiny sick babies. We are observing non-nutritive suckling. So it satisfies babies, infants' basic sucking urge, and about 2 sucks per seconds it will be there, and after 6 to 8 sucks there will be 1 swallow. So it can occur on breast or pacifier, or even sometimes finger. And POMI, that is perioral infant motor stimulation, we have started. And premature babies, there are 5-6 points where neonatal therapist and all of us have trained. We have taken one POMI workshop also online with POMI instructor who had invented it, and it helps to improve the sucking in the premature babies. It increases the GI peristalsis and helps to improve the digestion, and reduces the incidence of SIDS and stimulates the milk ejection reflex as well. So these are the few problems where baby needs special help. Cleft lip and palate, we can give obturator. And Down syndrome, there is hypotonia and dancer hold we have to give, particularly syndromes like micrognathia and PROB sequences. Again, we have to support the baby and mother for the feeding. So there are various drugs which can get secreted in the mother's milk by exocytosis, reverse pinocytosis, apical transport, transcytosis, and paracellular pathway. These are the 5 pathways how drugs get, medicines or drugs get into the mother's milk. So drugs which are compatible with breastfeeding, whenever mother is having any condition, we have to help the obstetrician or physician to choose the drug or medicine which is having low lipid solubility, having short life, having low milk to plasma ratio, particularly less than 1, which is having oral absorption, bioavailability should be low, and it should be having acidic pH, and it should be high with protein binding, high molecular weight, particularly more than 800 Dalton, and dose and duration of treatment should be minimized as far as possible. Whenever there are radioactive compounds, particularly studies of radioactive iodine, dye studies, after 5 half-lives, when radiation is gone, or after 10 half-lives when 99.90% of radiation is gone, we should advise the feeding to the baby. Till then, we have to express and dump that milk. So these are the galactococcus, domperidone. When mother is having, we have to cross-check whether that is perceived poor lactation or that is really poor lactation. If it is true reduction in the lactation, then we can give some galactococcus like domperidone 10 milligram 3 times a day for 1 to 2 weeks, depending upon the condition. Initially, we can give 3 to 5 days. Metoclopramide is having certain side effects, so domperidone is safer than other drugs which we are not using practically. I want to insist here that mother's milk can have various colors. This is actually red color, which is blood, and cracked nipples and other nipple injuries can lead to red colored blood, and we should not feed. This is the transition milk, which is orange colored, which is also normal. This is green color. Certain particularly cold drinks or certain so-called health drinks are having food dyes, and green food also can give greenish tinge. This is 4 milk, which is having bluish tinge due to calcium, reflected light on the calcium. Purple color, again, it can be due to food dyes and junction violet. Then residual blood can be seen particularly in rusty pipe syndrome. And in rusty pipe syndrome is normal condition, and we should continue to feed the baby in rusty pipe syndrome. So these are few different colors. Another aspect I want to introduce here, that is induced lactation. Induced lactation means when mother is not having even pregnancy at a single time, we can induce the lactation with particular certain hormones. I will not tell it in details, but we can do that. So what are the indications? Particularly nowadays, many parents are coming with adopted baby, surrogacy, then recommencing of breastfeeding after relactation, we can say. Then separation of diet or having some conditions, mother and baby. So initiation of the milk production can be done by, but we have to have one condition, which is encouragement of infant for the suckling of the breast every 2 hourly. Breast stimulation, assisted milk expression can be given, certain galactagogues and role of hormones is again there. So we have to mimic like normal pregnancy, and we have to start particularly from 7th month of pregnancy, whenever there is means planned adoption or surrogacy particularly. And we have to start mother's counseling, skin to skin contact of the baby, induction of the lactation can be done with the progesterone, high progesterone pills, then increase milk production with the help of domperidone, and then at breast supplementation. This is called as at breast supplementation, and breast milk is given through this bag or device, but we have devised Indian jugad, I can say, and feeding tube is kept in the wati with some milk, and baby suckles here. This you can see here sticking. So we give the baby like this, and slowly baby learns that milk is coming, and baby will start sucking, and it helps. And particularly many mothers are so happy with it. So gut microbiome already Sudhir had covered. I will not go now in that. So there are various maternal risk factors like diabetes, RS sensitization, infant risk factors, and we can see two broad categories, that supplemental intake jaundice and breastfeed jaundice. I will not go into the details, but only factor I want to insist is early initiation of breastfeeding and continuation of breastfeeding every 8 to 10 times a day. And if not possible, expression of the milk. So I want to see insist all the cues of the babies here. There are early, mid, and late cues. Early cues are babies saying, I'm hungry. That baby will start looking here and there, mouth opening will be there. Baby will turn their head to seek the breast and start rooting reflex. Mid cues, I'm really hungry. So stretching of the yawning, then stretching of the body, then increase physical movements, head to mouth, hand to mouth sucking. Then late cues is calm me and then feed me. That means we should start giving breastfeeding with early and maximum mid cues. Whenever baby has late cue like crying or agitation or color of the baby changes, even with hunger or excessive crying, we have to calm the baby first, and then only we have to give breastfeeding. Otherwise baby will not take the breastfeeding. So we have to give skin to skin contact, and we have to educate the mother and all our paramedical and health care staff, particularly grandparents and nurses, ayas, dayas, etc. All these early cues. I will request to stick this photograph in your NICU or PNC or delivery room so that it will be easily learned. Few words about the stem cells. Last week only I have presented this in European Milk Banking Association conference at Madrid. Mother's milk is having huge number of stem cells, and these are all cells which are pluripotent, which can get converted into any cell. At our stem cell lab, we could convert it into osteocyte, chondrocyte, and fat cells. But further studies are required, and it requires a lot of money and technology as well. But I want to insist only one point here, that is highest number of cell count was seen on day 2 of the delivery. So we must give breastfeeding as early as possible, and we have to extend the benefit of these stem cells. So these are the maternal conditions which we have already discussed, which can hamper the lactogenesis. COVID-19 already we know that it protects the breastfeeding baby during breastfeeding. So there are only few contraindications where we should not give the breastfeeding. If mother is having untreated brucellosis, herpetic lesions like this over the breast, particularly in the nipple area, and hepatitis B or C with cracked nipples, symptomatic hepatitis E infection, mother undergoing iodine or technician level scanning, and MDR TB is no more a contraindication, and with tablets and medicine proper with mask and BCG and INH prophylaxis we can give to the baby. And if there is recreational or illicit use of drug, particularly when baby can go have drowsiness, so immediately after taking the that drug or whatever mother is taking, we should avoid the feeding, or we should tell her that feed and express the milk and store, and then you can use if she is addicted really. So mother and baby form a diet, and we have to evaluate both of them. Otherwise, there is incomplete evaluation and it can create problems and will not help to solve any problem. Antenatal counseling of the mother is required, particularly about breastfeeding, early initiation, skin-to-skin contact, and frequent attempts for the expression should be emphasized. Identify at-risk mothers and babies, particularly neo-BFHI concept must be implemented. Neo-BFHI is particularly for the support and care of the breastfeeding for premature and sick babies, and all the 10 steps of baby-friendly hospital initiative are particularly for neo-BFHI modified, and you can see even online neo-BFHI 10 steps. I will not go into the detail to save the time. And it is important to study the normal infant anatomy, particularly oral anatomy, physiology of the baby, and presence of various signals are required, and we should be identified to have focus support case-to-case based. And it is important to encourage the mother to build the confidence, and our job is to support her as a healthcare worker. So happy and healthy baby, a safe mother will give secure babies. These are my references. Thanks a lot. Thank you. Thanks a lot for your patience listening.
Thank you, ma'am, for your such an informative talk. Questions are there. I think chat box questions are very less. My question for Sudhir sir is there any role of prophylactic role of LGG drops in preterm child?
Okay, so the probiotics have been used for many diseases, especially NEC in NICUs. So these are there were different strains studied. So those are the lactobacilli strain and bifidobacterium strain. So LGG, yes, in the many clinical studies they have been studied. So we typically start them for all babies who are less than 32 weeks of gestation, less than 1800 grams, as soon as they are hemodynamically stable. And the typical dose is around 12 million to 12 billion. So the standard dose is 10 billion. And you can start as soon as you start the feeding, hemodynamic stable baby. Continue till 34 weeks of gestation or 1800 grams. And there is more research on probiotics in NEC than any other research done in neonatology. So the problem with these strains is that limited availability of these strains in India. We do have a Probiotic Association of India, that's based in Delhi, who should monitor those probiotic preparations and their pH. Protatis is the only brand currently available which we are using for infantile colic. Otherwise, those brands which are there in clinical studies, they are used in NEC, yes. But you should follow all those indications, should not use them rampantly.
Okay. Thank you, sir. Another question is for ma'am, Mane ma'am.
Yes.
How to handle stress in a lactating mother? Are there some few steps?
Yes, actually, antenatal counseling is the best strategy. In fact, even I am an adolescent health physician. I start from adolescent age group.
Okay.
Though they are not married, they are not even, it's no question of having any it's nearby person who can ask them question also. But I tell them that this information you should carry, and you should search in your community, your relatives, and you should tell them proper information. So antenatal proper counseling is the best strategy to start with, because after delivery they will have so many sites where they will have pain here and there, anxiety, and they will not listen and follow. So we should have empathetic attitude. Whenever we are speaking, there should not be any negative word. तुला दूधच येणार नाही, तुझी साईजच छोटी आहे. Any negative word by any healthcare worker, any relative should not be there. Whatever she is having, we should always give her encouragement. And as early as possible, even at our institute, we are practicing. Whenever there is even cesarean section going on, whenever baby is out and stable, even before starting the stitches, we give the breastfeeding to the baby. And that will reduce the anxiety and stress in the mother also. And as early as possible, after normal delivery, baby should be delivered on the abdomen, preferably, and we should start with breast crawl. So early 3-4 feedings we have to support to the mother, and we have to show her proper latching, proper positioning, proper attachment, and address her queries, address her anxieties, so that it will be helpful for her to reduce the anxiety and stress.
Thank you, ma'am.
And that is useful for the secretion of happy hormone oxytocin. That again helps to reduce her anxiety, stress, and postpartum various blues and problems of the psychological disturbances.
Ma'am, what will the maximum duration for the domperidone as a galactogox? How many days we can give maximum?
If we are giving as a routine, 5 to 7 days is maximum. But for induced lactation, we can start from 7th month of pregnancy. Induced lactation, I am particularly. And induced lactation should not be practiced by anyone. It should be done under supervision only. And we are practicing here. We are having Dr. Mangalavani in Pune, who is obstetrician. She is doing routinely, and we have also done for a few cases.
Regarding BFHI, we have some policies.
Yes, baby-friendly hospital initiative. I will share in the group.
Okay.
Our hospital in DY, we have this is the certified baby-friendly hospital in our district, and we have certified it long back in 2013. And recently, we have received recertification from UNICEF. BFHI and Neo BFHI, particularly for newborns, Neo BFHI. Both the things I will share it in the group. 10 steps. And if there are students, they should remember that they can get short note on it, and even practical questions.
Yeah, thank you, ma'am.
And I request that wherever you all are going for cesarean section, or you are attending any calls, you insist that particular obstetrician to get that hospital certified, baby-friendly hospital. If not possible to get certification, no problem. At least you try to implement that 10 steps. That will improve a lot of percentage of breastfeeding. Success of the breastfeeding will be more.
Okay. Thank you, ma'am. Ramakant sir, are you there? Ramakant sir. Okay. No more questions are there.
Jin, there was one question somebody asked: are there any studies regarding schizophrenia and gut dysbiosis?
Okay.
So I don't know who asked it, but there are more than 200 studies regarding schizophrenia and dysbiosis.
Yes.
Okay. So many studies, and consistently found factors are the prematurity, NEC in those babies. The breastfeeding babies secrete more serotonin as compared to the formula feeding babies, and they have a different sleep pattern.
Yes.
And different sleep pattern, good sleep, of course, helps in good weight gain and growth hormone secretion, thyroid hormone secretion, which also helps in development of gut-brain axis. So all those factors, coming back to our root, breastfeeding is the best. And recently, there has been a flurry of articles from 2015 regarding the neuropsychiatric disorder and gut dysbiosis. And you probably should know that multiple sclerosis, such a devastating disease, can be treated with a fecal microbiota transplant. A number of trials are already on the way. And similar is the situation for schizophrenia. So in coming 5 or 6 years of age, with the help of artificial intelligence, we can map the individual's gut microbiota, do their genomic studies, and match those with the healthy gut microbiota and permanently change that microbiota and change the behavioral neuropsychiatric condition outcomes.
Even I will like to mention here that gut reset is new therapy for particularly autoimmune diseases, and many people are trying it and getting benefit out of it. Sudhir, will you like to highlight the benefit of human milk banking and in short?
Yes, definitely. We have been using human milk bank in our NIC since 2014. And I like to highlight some points about that. Apart from all the benefits which we get for using mother's milk, 3-4 things which is an observational and important thing which I like to praise, that after using a human milk bank, the incidence of chronic lung disease has gone down drastically. I mean, there would be any babies or hardly few babies in our NIC where we have been using steroids for those babies. And less use of steroids means less oxygen, and also their outcome, long-term neurodevelopmental outcome is good. So this was really very good, important factor. Second thing, this could be just an observational study. After using a human milk bank, our incidence of SIDS have drastically gone down. There are not many papers related to this, but we might continue our observation and might do some further studies on that. But sudden infant death syndrome, especially after 2014, only few cases have been reported. And third most important, that NEC incidence is almost zero in our NIC. So not a single baby who had necrotizing enterocolitis. I'm not talking about the days when you have an epidemic in your NICU and all babies get infection. So that is infection-related necrotizing enterocolitis. I'm talking about NEC, which is an inflammatory disorder. So the incidence of NEC has drastically gone down, survival has gone up, and survival without impairment has gone up. So I will encourage to use human milk bank wherever it is available, donor milk.
Apart from that, our total duration of stay of newborns in NIC had reduced.
Of course,
Hypoglycemia incidence has reduced. Hyperbilirubinemia has reduced, and mothers are also not getting any abscess. So overall, society is getting benefit out
yes,
of it.
In terms of pollution, in terms of financial constraint, crores and crores are saved and pollution has been saved. So
ROI, return on investment.
Yes, return on investment.
Thank you.
Sudhir, there are, I think I have seen one question. What are the neurological conditions which can be treated with FMT?
Okay, so as I said, multiple sclerosis in adult can be treated with this thing, Parkinsonism. They have already started studies on Parkinsonisms and Alzheimer's in adults. And of course, not direct neurological condition, but NEC, which can affect white matter injury. Okay, so you treat with probiotic. And I will urge all the consultant students who are here on this platform that when you are using antibiotics, please supplement with probiotics. So if you are giving antibiotics for more than 48 hours or maybe 5 days, especially for meningitis or culture-proven sepsis, please use probiotics with it.
Thank you, sir. Another question is there. Should top milk be recommended during initial 2 to 3 days to newborn after cesarean section?
Not at all.
Mother has less milk secretion.
No, not at all. Not at all. Because maximum mothers will have LSCS with spinal nowadays, except few. So we can safely start breastfeeding immediately after delivery. That's what I told. In our operation theaters, we have started.
Crowding.
Of course, it is taking it had taken a lot of efforts and lot of consistent and persistent motivation of all, and it helps for the healing of the mother also. And I already discussed for a lot of time that quantity of milk will be less, but quality will be the best. So don't bother about quantity, because baby is also required less, and that is thick and ketone bodies are produced in them. So don't worry about the quantity. Quality is important, and it is not at all the indication for the cesarean section for the top feeding.
Okay, and I will like to add on this that Madam has shown a slide that how much you need the stomach capacity in first 24 hours.
Definitely.
The colostrum is sufficient, and we just discussed about seeding. That seeding is very important. You give few drops of colostrum and start good seeding, which will prevent atopic diseases and long-term neurological outcome as well.
Correct.
So do not even
Cherry
thing
size,
and
yes.
follow the zero separation, that those four components. So even if you are delivering by cesarean section, you should deliver the baby on mother's breast, not on abdomen. So deliver the baby on mother's breast, allow breast crawl, start feeding within 5 minutes. So everywhere in examination, when you ask students, they will say start breastfeeding within 1 hour. Forget that 1 hour, you should start within
As
5
early
minutes.
as possible.
As early as 5 minutes. And you know, in NRP, those who follow in NRP, we say golden 1 minute, golden 1 hour, and all those things. Here it is important for that seeding, which is going to go with lifelong. Remember, for whole life, you have one brain and one gut. So if you want to develop that good brain, you have to have a good gut there at the down. And you know, in few years there would be recommendations that all the babies who are born by cesarean section should have vaginal swabs taken from the mother and sprayed on baby's mouth and skin to develop that healthy microbiota.
Sir, another question is there. If mother milk is decreased at the age of 4 or 6 months PNC, then what are the galactogogues which can be used? Are they effective?
There are various.
Okay, sorry.
There are various galactogogues which are our traditional galactogogues also, like fenugreek, methi, bajri, even जे traditional galactogogues आहेत, because we cannot deny their effectivity. They are not even there are no any studies published, not in much numbers, but practical experiences, yes, that works. So we can tell them to continue their homemade whatever preparations and galactogogues, but domperidone we can start, and even there are lactare and vatsalyakal. There are few preparations which we are using and having good results. Sudhir, you will like to add?
Yeah, galactogags in randomized control trials, means मेथीचे दाणे आहेत ना, फेनोग्रिक, that has been shown good input. आणि शिरांच्या भाज्या, म्हणजे आपण सांगतो ना, लोक आपल्याकडे गवार खाऊन देत नाहीत. शिरांच्या भाज्या म्हणजे चवळीची भाजी असेल किंवा शेवग्याची भाजी असेल, ज्या शिरांच्या भाज्या असतात ना, दे आर गुड लॅक्टोगोग. आणि आपल्याकडे अजून एक असतं की कांदा लसूण वगैरे खाऊन देत नाहीत. सो कांदा, लसूण, गार्लिक, दे गुड लॅक्टोगोग.
Lasun is garlic is
yeah, good lactogog.
Good galactogog.
Thank you, sir. Now there are no more questions. Definitely, if any questions are there on YouTube, we will connect with you afterwards also.
Yes, I am sharing the BFHI policies and new BFHI steps.
Thank you,
Sachin. Thank you, Maha.
No, just 1 minute, sir. And sir, today's MMC observer, Dr. Sachin Gaikwad, sir. Are you there, sir? I think sir has left. Okay. Now it's time for vote of thanks. So it's my immense pleasure to deliver the vote of thanks on behalf of Maha AP 2023. First of all, many thanks to all the faculties, Dr. Sudhir sir, Dr. Mane ma'am, such an informative talk, and definitely after listening you, we will improve in our day-to-day practice so that baby's output will be maximized. Many thanks to respected Dr. G. Baswaraja sir, the President 2024 CIP, for blessing our today's session. Many thanks to MMC observer Dr. Sachin Gaikwad sir also. And first and foremost, many thanks to all the delegates who was joined on Zoom as well as on YouTube for today's sessions. And many thanks to Maha AP OBs and President sir for the all cooperation needed. And thank you, Pallavi ma'am, for the all technical supports. So at last, good night, everyone. Once again, thank you.
Thank you. Thanks a lot.